Dyke, and Dr. Stephanie Schauer, Division of Public Health Immunization Program Manager and a big part of our COVID response team. And we will begin today's briefing with remarks from Deputy Secretary Julie Willems Van Dyke.
Well, good afternoon, and thank you very much for joining Dr. Schauer and myself for this vaccine briefing. As I've said before, COVID-19 vaccination is the most significant public health intervention of our time. And while we are only weeks into this monumental undertaking, incredible progress has been made. We hear stories from across the state from our Phase 1A healthcare workers and the residents and staff of our skilled nursing facilities expressing gratitude and relief when they receive their shots. And at the same time, we also know many of you are frustrated and feel that vaccine rollout is taking too long. We hear you, and we want to reassure you, everyone in Wisconsin who wants a vaccine will be able to get a vaccine, but it will take some time. We are currently still in Phase 1A, and we are working diligently to vaccinate our healthcare workers and the residents and staff of our skilled nursing facilities. That vaccination process is complex, and I know you have a lot of questions. So I want to walk you through the COVID-19 vaccine allocation, distribution, and administration process. So the first step in the process is that the federal government determines allocation based on our state population for the upcoming week. The next step is that DHS sends out a survey to registered vaccinators in Wisconsin. This is for us to determine each vaccinator's capacity for storage and for scheduling of vaccine clinics. For an example of how we are growing our capacity in Wisconsin for these eligible vaccinators, on December 14th, we had 108 eligible and enrolled providers that could vaccinate. As of January 5th, we have 1,066, full tenfold increase over the last few weeks. So we now have that many more people who can answer the survey compared to just over 3 weeks ago. Based on the results of this survey, we allocate vaccine to each provider, and DHS sends the order into the federal government. The federal government receives the order and then ships vaccine, which can take a few days. For the Moderna vaccine, the vaccine is shipped directly to the vaccinating locations. For the Pfizer vaccine, due to the extreme cold storage, it is shipped to regional hospital hubs and then redistributed to clinics by our staff on the vaccination task force. This includes staff from Wisconsin Emergency Management, the Departments of Health Services and the Department of Natural Resources, the Wisconsin National Guard, and the State Patrol. This is a great illustration of how we are working across state government to accomplish this amazing task. Once the vaccine is received, vaccinators schedule clinics and do the work of vaccinating, getting shots in arms. And then vaccinators update the Wisconsin Immunization Registry with data. From start to finish, this process typically takes between 7 and 10 days. I'm very happy to report to you that we now have vaccinated a total of 110,201 people with doses of vaccine. In this post-holiday period, we are seeing a significant increase in the number of daily doses. On Monday, we administered about 6,000 first doses statewide. On Tuesday, that rose to about 8,000 first doses, and yesterday, about 11,600 first doses, or nearly double what we had done on Monday. We are also now seeing the administration of second doses, with nearly 5,000 people receiving their second dose and thus fully completing their series. And let me pause and clarify. I want to be very clear. The 110,201 doses that we've given so far includes doses. Now we're giving second doses in there, so those take away 5,000. It's about 105,000 people who have received the vaccine. Throughout this pandemic, we have focused on the need for everyone to be in this together. And we've done a great job here across Wisconsin. And when you hear these numbers and think about this process, I want us to think about how we're all in this together with our vaccinators, because it includes people vaccinating in hospitals, in local and tribal health departments, in medical clinics, in federally qualified health centers, in pharmacies, in long-term care facilities, in home care agencies, and more. All of these providers have gone through mandatory training to ensure the vaccination rollout is safe. And all of these providers are also continuing to do their jobs beyond vaccination, caring for patients and residents and the public, providing response to the pandemic, providing contact tracing and testing in our public health agencies. We know our public health and healthcare systems is staffed with incredible individuals. And we also know we are asking a ton of this system for even more resources, space, energy, and effort during an already challenging time. Our public health and healthcare workers are rising to that challenge, as they have throughout this pandemic. And it's up to all of us to support them by making the vaccination effort as effective as possible. We do that by continuing to stay home when possible, to wear a mask and physically distance if you have to go out, and washing our hands thoroughly. We still need to fight the pandemic while we ramp up this vaccination effort. And it's going to be a number of months before we can let go of these important habits that we've learned over the last year. And with that, I'll now turn it back to Elizabeth so we can take your questions.
Thank you for that. And a reminder to all of our reporters out there, to maintain audio quality, please remain muted until it's time to ask your question. If you are on the phone and you're able to do so, use *6 to mute and unmute. The first question today goes to Rob Sussman at WTAQ in Green Bay.
Hi, yes, thanks for doing this call. Secretary Robin Vos, the Speaker of the House, yesterday criticized the vaccine distribution process, saying that there are county health departments who don't know what's going on, haven't had any contact with the state whatsoever on when they might be getting a vaccine. The city of Appleton just recently got their first shipments of the Moderna vaccine. What would you say to people who are concerned about the vaccine distribution, and how exactly is it being determined which areas get vaccine first? Thank you very much.
Yeah, those are great questions. So in the early days of the vaccination rollout, we prioritized hospitals and health systems. We know that's where we have healthcare staff who are in direct contact, taking care of patients in very intimate settings who have COVID-19, and we wanted to make sure and get vaccine first to those people who were on the front line of taking care of known infected patients, and especially those who were taking care of them in situations where they were conducting procedures that put them at greater risk. So that was our first line of attack, and I also want to remind people that this vaccine came out the week before Christmas, and so it was the week before and the week of Christmas that hospitals and healthcare systems were our priority. While we were getting vaccine out to those folks, we were very busy enrolling other providers in the program. So the week after Christmas, we began to send that survey that I just talked to you about out to public health and to federally qualified health centers. We've been updating public health throughout this with a weekly meeting with them and So while I understand there may be a public health worker who hasn't heard, certainly people within their agency have been attending our weekly updates and would have that information. So the week after Christmas, the survey went out to a number of health departments, and all health departments were enrolled by the first of the year. And so they are included in this third and fourth week of vaccine distribution, along with a wide variety of other providers that I've mentioned, medical clinics, pharmacies, and others. So as we said, the first few weeks was very targeted, and in this third and fourth week of vaccine distribution, we have thrown the net quite a bit wider, and people are getting up and going with vaccinating. And that is why you see this rising number, like 6,000 on Monday to 8,000 on Tuesday to 11,600 on Wednesday. It is a result of many more vaccinators being involved and being able to get this effort out to far more people.
Thank you for that. Let's go to the next question to David Wahlberg at the Wisconsin State Journal.
Yes, thank you. According to the data on the DHS website, as of Tuesday, there were about 266,000 doses that had been shipped and about 85,000 administered. I know you just updated that latter number to about 110,000, but I'm wondering what explains the difference there. That was, as of Tuesday, about 181,000 doses. Why are they here in Wisconsin but not getting into people's arms?
Yeah. So David, let me help you understand that. So of those doses that would be those 176, that difference between the 266 and the 110, right? Which right now is about 156,000, so a little less than what you described from the data that was on there on Tuesday. So 156,000 doses that have not gone, that are not in the arms but have been shipped. So 105,000 of those were shipped this week. So on Tuesday, some of them hadn't even arrived. So that is the number that are in the process of shipping or are in transit. So 2/3 of the 156,000 that are left were in transit, 105,400. That leaves about 51,000 that would be doses that are left from last week. And those are the doses that people are using to vaccinate this week. That number was closer to 75,000 on Tuesday. So at any given time that those doses shipped is going to be a combination of the doses we've given, the doses that are in transit, and the doses that are on people's shelves. What we have asked each of our providers in this weekly survey is, do not order if you have a week's supply on your shelf. You should only be keeping 1 week's supply on your shelf. People are always going to be about a week behind because they have to plan ahead. This is a very fragile vaccine. You have to find out how many people are coming in and then only thaw that many doses to administer it, because the last thing we want to do is waste doses as well. So there's some very careful planning. We're always going to be about a week ahead, a week behind with the inventory on the shelf. So we are asking our providers only keep 1 week of supply. We've had some providers say to us, we're done with our 1A and we still have vaccine. What would you like us to do? And we have gone and picked up that vaccine in many situations and redistributed it. So we are asking providers not to keep vaccine on the shelf waiting for the next phase, but let us know and we'll get it redistributed across the state and to the counties that still have plenty of 1A providers that need to be done. And get those shots in arms.
Thank you for that. The next question to Todd Richmond at the Associated Press. Todd Richmond.
Hi there, can you hear me?
Yes.
I have a two-part question. So, as Julie just said, nobody is going to be able to enter Phase B until the entire state is done with Phase 1A. says people are being asked, people that are already done with phase A have to send their vaccines back. So does that mean that we all go into phase B together, and there's no vaccinators can start doing phase B on their own yet until everybody's there? The second was, at this rate, I mean, you have not even vaccinated a quarter of the phase 1A healthcare workers. How is this approach viable at this pace for the long term? Even if you are ramping up by a couple thousand doses a day, how is the state ever going to reach 70% vaccination in short of like 3 or 4 years? Thank you.
So Todd, thank you for your question. I'm glad you're always listening closely. And let me be clear, I did not say that we have to finish every person in 1A before we go to 1B. What I'm saying is we're doing a statewide approach here, and we want to make sure that we have a substantial portion of 1A done before we move to 1B. At a point in time, we think we have most of 1A done and we've exhausted that. Then we will move into 1B. I want to also emphasize that this is the startup phase of this effort. And in order for us to get to herd immunity, as you are outlining, before 3 to 4 years are up, you're absolutely right. We're going to have to increase the pace of this. And that's going to take, I keep saying to people, this is a three-legged stool. And it takes 3 things in order for us to get to that high level of herd immunity. First of all, we have to have demand. And clearly we have demand in this state, and we want to respond to that demand. Second of all, we have to have the system to deliver the vaccine. And as you are seeing and playing out, our system is working, and we are in the process of continuing to increase entry points for people to get vaccine in our state. And the third leg of the stool is we have to have adequate supply of vaccine. And that is the limiting factor here, because we are receiving about 70,000 doses of vaccine a week. Yes, there are 420,000 allocated to Wisconsin, but currently over 106,000 of those are already allocated to the pharmacy program, as we have said. And we will have to allocate another 90,000 to that program over the next few weeks. So that's going to take a significant portion of our new supply coming in each week. And so we have to titrate this with supply to demand in order to get there. Now, you know, I know President Biden has laid out a goal of 1 million doses a day for the first 100 days of his administration. And I am here to say, President Biden, we are ready and willing to work with you on that. That would translate into about 18,000 doses a day here in Wisconsin. As I just mentioned, we were at 11,600 yesterday. We don't have a whole lot farther to go to get to 18,000 new first doses a day to meet that demand. However, 18,000 doses a day is 126,000 doses a week, and we're only getting 70,000 doses a week. So you see what the problem is here. We don't have enough supply to open the gates much wider and be able to meet the need. So we're working very hard on skilled nursing care, assisted living facilities, our essential healthcare workers, including those who are unaffiliated from hospitals. So getting to EMS, getting to dentists, getting to people who don't work for a typical vaccinator. We'll be moving those forward over the next few weeks, and I anticipate we'll be moving into phase B before the end of the month. 1B, phase 1B.
All right, thank you so much for that. Let's go now to Danny Maxwell at WKOW in Madison.
Well, Julie, thank you. I think you kind of answered my question right there at the end there, when we might be moving into 1B. You said before the end of the month. I know Governor Evers the other day said he was expecting maybe to get his vaccine over this summer. So is that what we're thinking for a time frame for like the vast majority of the public, the 1C, or can you give us a time frame if you have one for 1B and 1C?
Yeah. So the caution I would give you is anything I am hypothesizing here is clearly a hypothesis, because remember my three-legged stool, right? We have to have demand, we've got that, we got to have the system, we're going to have that, but we have to have supply. And so, you know, what we're really hoping for and what we're hearing from our federal partners is that we likely will be seeing a higher supply of the Pfizer and Moderna vaccine in coming months. You know, they were just ramping up their manufacturing process. And so they're very hopeful we'll be seeing more supply of those two vaccines. But to really get us through a higher throughput of people through these phases is we're going to need more new vaccines. We're going to need additional vaccines. And so a big part of what will guide us of moving from 1B to 1C to the general population will be the success of some of the other vaccines in vaccine trials. So the two that are currently in trials right now that may come in the next few months are the Johnson & Johnson vaccine and the AstraZeneca vaccine, and then a fifth vaccine that just began trials late last month. So a big part of the answer to your question is contingent on supply. Supply is contingent on manufacturing and on adding these new vaccines. So just think, it also depends on how many people we put in each phase. So in this current phase, we have a little, 500,000 or a little bit more are in phase 1A. Depends once we receive the final recommendations from the SDMAC, what we'll see about the number of population in phase 1B. But if they're a similar size, I would anticipate it would take us a similar amount of time with a similar supply, another 4 to 6 weeks. And that would put us in 1C, which I anticipate will be a much larger population. And then we'd have to see again where we are with supply before we'd get to the general population. But most people are predicting we'll be there by early summer, and maybe with increased supply, we'll be there a little bit earlier.
Thank you for that. Let's go now to Jessica Van Egeren, Up North News. Jessica.
Hi, this is Jonathan Sadowski, filling in for Jessica. My question has been answered. Thank you.
Thank you. We'll send the next question to Brian Krumholtz, WLUK in Green Bay. Brian. Fox 11 Green Bay. Remember, *6 will mute and unmute your phone. All right, we'll try to get back to Fox 11. Let's try Sean Kirkby, Wisconsin Health News. Sean Kirkby.
Hi, thank you for holding this. It's my understanding that half of nursing homes in the state will have had a COVID-19 vaccine clinic as of next Monday. Can you confirm that and provide an update on how the rollout is going? When do you anticipate all nursing homes that have gotten their first vaccine? Thank you.
Well, I realize I've been talking a lot, and so in just a moment I'm going to turn it to Dr. Schauer to give you further visibility on the nursing home program. Before I do that, I just want to clarify for people, as you know, the pharmacy program for long-term care is split into 2 sections. Part A, which is skilled nursing homes, which I'll ask Dr. Schauer to speak to, and Part B, which is assisted living facilities, which we have not yet begun. But I'm happy to announce that we have notified CDC. We are ready to start Part B, the assisted living portion of that program, and that will begin the week of January 25th. One fact that I think is important to understand about assisted living versus skilled nursing facilities is there's a lot more facilities. And so, but they're much smaller. So many times a pharmacy can do 2 or 3 assisted living facilities within one day, whereas a skilled nursing facility often takes them a full day, and sometimes with the size of them, even a couple of days. So we're very excited about the expansion of this program at the end of the month. And let me turn to Dr. Schauer to give you an update on how things are going in the second week of rollout with the skilled nursing facility program.
Yeah, thank you. So for the skilled nursing facility program, there's 356 facilities that are in that, and both CVS and Walgreens are doing the vaccination of these facilities. They're currently scheduling and have about, by the end of the week, should have about half of them done. So we anticipate that within the 3rd or 4th week that they will have gotten through the first dose for all of these entities. It is dependent upon scheduling, and so there's a little bit of variability in there, but they are working hard to get into those facilities to go ahead and vaccinate both patients and staff with their first dose. And then they will go ahead and start scheduling the return so that they can administer that second dose.
All right, thank you for that answer. Now to Gabriella Rusk, WMTV in Madison.
Hello. Hello. I have a question about staffing for public health departments. One of the things that I've been told from some smaller health departments is they have the doses, but they don't have the staff to administer all of the doses. So what is the guidance, I guess, from the state, or what is being done to have maybe retired nurses or other vaccinators step in to help speed up that process in the smaller areas?
Yep, that's a great question and a real challenge in our state. So there's several ways we're approaching this. One is health departments have the opportunity to use the Wisconsin Weaver system, the system for healthcare volunteers, and is certainly something they could access to see. That's a great opportunity to see retired staff or people willing to volunteer who might be able to assist with vaccine clinics. A second option for them are the mobile vaccination teams that we're getting ready to deploy from the state vaccination task force. You know, our philosophy around the delivery of these type of services in Wisconsin is that this is a local control, local responsibility, and that's why we have local health departments. But we also recognize that there are times where conditions are such that people do not have the resources. Their resources are overwhelmed. Just think if you're a small health department with only 5 or 10 staff, and you've been working for the last year doing testing and contact tracing day and night, and working with your school districts to keep them safe and your employers to help keep them safe, you know, your staff is pretty tapped. And so the mobile vaccination teams will be an opportunity for local health departments to request assistance from the state, and our mobile vaccination teams will be able to go out and assist them with vaccination clinics in their community. And the third piece is, as you may very well be aware, the legislation that was passed by the federal government late in December included money for vaccination efforts, and we received notification of what our initial award will be on that, which puts us in a better position now to be evaluating how much of that money we'll need to support efforts here at the state and how much of that money we'll send out to our local partners to assist them with their vaccination efforts, including the opportunity that many of them may elect to hire additional staff.
Thank you for that. The next question to Stephanie Hoff at WisPolitics.
Hi, and thanks for taking my call today. I'm curious as to the difference between how much the state is, how many vaccine doses the state is asking from the federal government versus how much we're getting. every week?
Stephanie, do you want to comment on that?
Sure. So the federal allocation that we receive is determined by the federal government, and it's based on a percentage using population. So we don't have, they tell us the number of doses that we will be receiving each week, and that it's up to the state to determine where those doses will go to which providers. So we do the allocation, but the actual number of doses coming into the state is determined by the feds, and we do, you know, sort of accept all of the doses that are given to us and plan those doses out.
All right, thank you for that. And now to Madeline Anderson at Fox 6 in Milwaukee.
Hi, I had a follow-up question to the federal pharmacy partnership program. So for the assisted living facilities that are going to be receiving their shots beginning January 25th, does that mean that the state has now banked the 140,000 vaccine doses that it needed to begin this process, or are you planning to do so over the next 2 weeks still to reach that 140,000 threshold? Thank you.
Yeah, great question. So as Secretary Palm reported earlier this week, we had 50,000 that we had set aside for that program, and the remaining 90,000 will be taking out of our allocations over the next 4 weeks. So, so the result of that, which I think is an important thing for people to know, is that will be a significant reduction of Moderna vaccine available for other purposes over the next 4 weeks. So we'll still have our full allotment of Pfizer vaccine to be distributing across the state to community-based providers, but we'll be a little leaner on the Moderna product while we are transferring those doses over for that program.
All right, thank you for that. And now to Ben Boken, NBC 26.
Hi, yes, my question is about, you know, I spoke to a woman who works at a hospital in Wausau, and she actually mentioned to me that she had to drive all the way down to Milwaukee to receive her vaccine, you know, despite her being kind of one of those frontline workers. Can you explain a reason for this potentially?
I can't. I'm well aware that the Aspira system in Wausau has received adequate vaccine. Stephanie, do you have any thoughts?
I don't.
Unless she was so eager to get vaccine before the supply arrived at Aspira's Wausau Hospital.
All right, thank you for that. Let's go to Andrew Havernack, Spectrum News. Andrew. Spectrum News. Reminder, *6 will mute and unmute your phone. All right, we'll try to get back to Andrew, and we will go to Daphne Chen at the Milwaukee Journal-Sentinel. Daphne Chen.
Hi, thank you for taking my question. I couldn't tell whether that means that we have officially activated Part B of that pharmacy program. But if so, I was curious why Wisconsin took a little longer to activate that than other states. And related to the assisted living question, we've been hearing some. Yes, can you hear me?
So we are talking to Daphne right now, and Andrew will try to come back to you right after. And Daphne, why don't you go ahead and finish your question?
Well, Daphne's question, I think, was about Part B and whether we'd officially activated it. Yes, we have officially activated it. We have to give 2 weeks notice, so we activated it this week, and it will begin the week of January 25th. And the other part of the question, and as I understood it, was why it took Wisconsin longer to do this than other states. Well, I know, first of all, I know states are in all different stages of doing this. Certainly some states have already done it and other states are probably still preparing to. But one of the challenges that we faced was this was a significant volume of vaccine, and we couldn't start until we had at least 50% of the vaccine available. That's why we were reserving a portion of our vaccine for this purpose and why it wasn't yet out into people's arms. So we had to save that portion of vaccine. Now, I know the natural question then is, well, didn't other states have to do that? And each state has a different proportion of people who are in long-term care facilities and assisted living facilities. And when I reviewed the data that CDC provided to us when the program was beginning, it appeared that Wisconsin was about the 4th highest state in the nation for populations in assisted living facilities. So each state uses their regulatory capacity and the way they structure care for people in long-term care differently. And clearly our state uses this kind of setting very extensively for older adults. You know, many of the assisted living facilities are smaller. They are more home-based types of facilities than a more typical institutional nursing home is. And our state has worked very hard to keep people in the most home-based, to allow people to age in the most home-based setting. And so that really wasn't surprising to me. But when you think about it, 4th highest, you know, there were places, you know, much larger than us that had many fewer assisted living facilities. And when you think about that, then that becomes an issue of ratio of vaccine you have, because that's distributed by total population. And so it took, you know, I haven't done this comparison, but the logical conclusion would be it took a higher percentage of our vaccine to be ready to begin that program.
Thank you.
Stephanie, anything you would add?
Oh, that's exactly it.
Yeah.
Okay. All right, thank you both for that. Let's try to get back to Andrew at Spectrum News. Andrew, do we have you on the line?
Yes. Yes, can you hear me?
Yes, we can hear you. Go ahead.
Okay, excellent. So this is a follow-up to what somebody asked a little bit earlier about what you would like to see, or I guess what the state is getting from the federal government compared to what it would maybe like to see getting in. You were saying earlier that you're getting about 70,000 doses per week. What would the state maybe like to see to maybe speed up this process of getting through 1A?
Well, we're going to get through 1A pretty quickly. I'd like to talk about speeding up the process to get to 70% herd immunity across the whole state. And in order to do that, we're going to need to have double to triple the number of doses that we're currently receiving now on a weekly basis to get there in a reasonable period of time, which I'm thinking is by the fall. So it's a significantly higher number of doses that we would need to see in order for us to be immunizing people at a level to get to that 75 or 80% immunity by the end of this year.
Thank you, Deputy
Stephanie, do you think do you have any more precise figures on that?
I don't, but I would add, I think, and if I can just take the opportunity to go a little bit, to put it into comparison, you know, we are still in influenza season and we've only got 37% of Wisconsin individuals vaccinated against influenza. And that, you know, has been going on since August. And so I think it certainly is different scale, but it does remind us that we have a vaccine for a respiratory disease, and we're coming into the sort of high point of influenza season. Typically, we've had a quieter than usual flu season so far, but really right now is the time when flu activity picks up and often peaks in the next month or two. And so it's really important that people recognize that flu is serious and important to protect yourself against this particular respiratory virus. In addition, I would add in is that This week, we have also updated the data regarding childhood vaccinations. And for 2020, across the board, in all ages, we've seen a significant drop in the number of vaccines being given to children. They're not getting the vaccines that they need on time, and this is leaving them vulnerable to serious diseases like measles and mumps, but also influenza. And I think it's just important to remember that as we eventually get to a place where people are interacting with others face to face and people are traveling, we're more likely to be exposed to these diseases, these vaccine preventable diseases. And it's important that we don't have groups of children who are susceptible, and we need to do all that we can to protect them. So, I know we're all anxious about the COVID vaccine, but I think recognizing the fact that we have safe and effective vaccines that are available now, and really encourage parents to talk with their healthcare provider and make sure they themselves as well as their children are up to date for all their needed vaccines. Another way that people can see if there's anything that's missing is using the Wisconsin Immunization Registry and accessing your child's record, and that can also be a tool that you can use to start that discussion with your healthcare provider.
Thank you so much, Stephanie. I think that's a really critical piece to remember is, yes, we all are eager to have a COVID vaccine, but we can protect ourselves from influenza right now, and we certainly need to protect our children with all the great vaccines that prevent all those diseases that used to kill them at much younger ages. So thank you for that important reminder.
Thank you both for that. Let's go to Nick Bohr at WISN TV.
Good afternoon. I've had a question about the prioritization of the vaccination within 1A. You're prioritizing frontline medical workers versus, say, chiropractors or pharmacists within 1A. Is that prioritization acting as a barrier in any way to getting as many people vaccinated as quickly as you could?
Well, I think that prioritization was both a combination of making sure, and it followed guidance from our state disaster medical advisory group to make sure we were getting first to the people who were closest to people diagnosed with COVID, who had the greatest risk for exposure. It also was by working with major health systems in the very early days when we were all still learning how to store the vaccine, how to give the vaccine. It was also a very efficient way of getting a fairly large group of people vaccinated very quickly. I know for those who weren't in that group, it felt like it wasn't an efficient way because they weren't getting vaccinated, but it also gave us the time to get the systems up and going that we now see are in place and are vaccinating EMS workers and pharmacists and dentists. And frankly, the healthcare systems who are an important partner in this needed to protect their own staff first before they were going to be ready to be vaccinating people from other entities. So it's a staging that I think was very reasonable, and I think a staging that has set us up well for success as we move forward.
Thank you. The next question to Henry Redman at Wisconsin Examiner.
Hi, thank you. There's a number of rural counties across the state that either don't have any retail pharmacies or have just one retail pharmacy across the whole county that can give immunization services. So in the absence of the storefront in someone's town, how can DHS help build up distribution infrastructure to help health departments get people vaccinated when it becomes available to the general public?
Yeah, I think, again, a couple of ways to do that. One is with mobile vaccination teams, similar as we think about how we've done this with testing across our state. We've been able to send mobile testing teams out to many of those same rural counties to make access to COVID testing available to them. And we'll be using our mobile teams to emulate that model with vaccine going forward. And then secondly, Many of those counties do have medical clinics, and so definitely accessing people's medical home is important. Sometimes I do understand that's in the next county or the next county, but people are accustomed to receiving medical care that way, and that will be another important access point for them. A third will be, as I mentioned before, funding for local health departments that could enhance the local health department's ability to provide those services. So I think what your question illustrates is the importance of a diversity of pathways for people to be able to get this vaccine, and that will be what we'll continue to build as we move forward. Stephanie, anything you would add?
I would just add that in the registration process, we have certainly noticed that local health departments are going ahead and registering many sites within their county, not just the one or two where they typically provide immunizations for flu or routine childhood immunizations. So they are thinking about access points and moving throughout their communities and where it makes it easier for folks to receive vaccines. So that is part of their thought and planning, is increasing those access points, which may not be visible when you think about it right now is where one health department is located. They are thinking more broadly.
Thank you for that. Next question to Natalie Sopola, WAOW. Natalie.
Hi guys, thank you for taking my question. So a new report says that the rapid antigen tests used by the UW systems missed a lot of positive cases. I think the numbers are approximately 20% in those showing symptoms and almost 50% in asymptomatic people. And so I'm wondering, what is the difference between the rapid and the regular test, and should rapid tests be used if they're missing a lot of results like these?
Yep, this is the great dilemma between the molecular PCR test and the antigen test. And so all of this is part of the decision making about what is the best test at the best time for the right patient. We do know that the antigen tests were tested in people who were symptomatic, and so the study you reference is great contribution to the science, because it also tested the sensitivity and specificity of the test, or the ability of the test to find true positives or false positives, true negatives or false negatives, when the test was used in asymptomatic people. And the results that you're reporting certainly call into question how effective that antigen tests are for asymptomatic screening. It does seem to be a fairly reliable test for people with symptoms. It also can be a fairly reliable test for people who are receiving regular testing, every few days. And so those kind of situations, I know on many of the UW campuses, they have a regular testing cadence, for example, for students who are living in the dorms, and they may be a viable mechanism for that. The reason people like the antigen test is because, as you know, with our PCR molecular tests, it takes a few days to get a result. And during that time, especially if you're symptomatic, you have to stay home and isolate in case your test is positive. The antigen test gives you results right away, but the downfall is it is not going to be as accurate as that molecular test is. So you have a bit of cost for speed, and we have to work together to figure out what the most effective way to use those tests are. I know when UW set up their screening clinics, this is one of the things they were doing to test the reliability of the antigen tests with asymptomatic populations. We also worked really closely with them to help them think about what are the most common ways we get the false tests, and that people should have a confirmation PCR molecular test done right at the same time. And that is people with symptoms who test negative. So that's those false positives you were referring to. We recommend anyone who has symptoms, gets a negative antigen test, immediately gets a PCR test to be sure it was accurate. And the same thing on the opposite side. If they have symptoms and get a negative test, we want to double check them as well too. So, excuse me, I said that the opposite way. If they get a positive test and they don't have symptoms, so the things you wouldn't expect. So I like to think of it, I often say to people, an antigen COVID is kind of like a quick strep. How many of us as a child are taking our kids to the doctor? You know, they did a quick strep, they did a swab, and they came back and said, yep, it's strep positive. And you get your penicillin. But sometimes, remember, they would say, nope, it's negative, but we're sending it for culture. And a day or two later, you get the call it's positive. That's exactly the same kind of thing, is that quick strep is not as reliable, just like the COVID test is not as reliable. And so it is important, as we think of testing strategies, to think about how important is accuracy versus speed and make decisions accordingly.
Thank you. The next question to Mary Jo Ola, TMJ4. Mary Jo at TMJ4 in Milwaukee. All right, we'll try to get back to Mary Jo. Let's go to Mayan Silver, NPR. Mayan Silver.
Hi. Hi there. So I just have a quick question about, we've been talking about, supply as definitely a big factor to whether or not we can get vaccines rolling out on a smooth basis. What do you see as the other obstacles to a smooth rollout in Wisconsin, as we see, as Florida goes into the elderly population to give vaccines and there's lines out the door? How is Wisconsin going to avoid things like that? And what is the infrastructure obstacles that you see beyond supply?
Well, I'm just going to be very clear that one of the reasons Florida has lines out the door is they don't have enough supply. They opened up that phase with still a very limited supply, and that's why they're having lines out the door, because they only have so many doses a day to give to people. So supply is really core to this. But I'll name one or two, and then I'll turn to Stephanie and see what else she would add. I think, first of all, it's making sure we have a number of vaccination points throughout the community. And the second piece of that is how we communicate that to folks so that people know where they have access to vaccine. I'm just going to re-emphasize that I think for the majority of people, where do you get your vaccines now? You get them at your doctor's office. You get them in your medical home. And so, that is the first thing I want people to be thinking of when I think of vaccine. Let me call or my physician or my nurse practitioner and see if there's vaccine available at my clinic and go and get it there. So Stephanie, what else would you add in terms of barriers that we're working on to make rollout great?
Barriers, and I guess I went towards, and it's not a barrier, it's actually an asset that I think we don't, that other states may not have, is that it's our partnership and with the pharmacies. We have good working relationships with pharmacists and the Pharmacy Society of Wisconsin, and they are a strong force when it comes to providing vaccines in any given year, and we see that particularly with flu. And so I think taking advantage of all that pharmacies have to bring to this is going to be important. Not only the independent pharmacies, but the chains, and all working together to try and provide a more thorough network and access points where people can get vaccines. As noted, there are certainly some areas where those are underserved, but I think for many parts of the state, pharmacies are a vital part of the vaccination network.
Thank you for that. The next question to Sierra Whaley, WJFW in Rhinelander. Sierra at WJFW. All right, we will try to get back to her, and let's go to Maddie Heim at the Appleton Post Crescent. Maddie Heim.
Hi, thanks for having this call as always. I wanted to go back to something that was said a little bit earlier about the 356 nursing homes and having about half of those done by the end of the week. I was just wondering, is there a specific number of doses that have been administered to those nursing homes that you could share? Thanks.
I don't have that information. They are reporting it to the Wisconsin Immunization Registry as well as to the federal sources. It does take some time to go ahead and have that information sort of percolate through. And information that comes into the Wisconsin Immunization Registry is with all of the other entities, so we don't have a breakdown of the number of doses that they have provided up to date as we do. They are included in those numbers that we've cited as overall numbers.
All right, thank you for that. We have 3 reporters that we were unable to get to when called upon. So let's try to go back to Brian Krumholtz at Fox 11. Brian at Fox 11. Mary Jo Ola, TMJ4. Mary Jo at TMJ4. And Sierra Whaley, WJFW in Rhinelander. Sierra. All right, and with that, we will then conclude today's briefing. We want to thank Deputy Secretary Willems Van Dyke, Dr. Stephanie Schauer, and all of you for participating. And we ask you to continue to monitor the DHS COVID-19 web pages for data and for guidance. And you can find additional information on the governor's website, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management websites. Thank you so much. Have a good afternoon and be safe.